Hey Angie, I'm Catherine with the Occupational Therapy Assistant Program at Nashville State, and I'm just going to talk to you about how to put on your resting hand splint. Is that okay?
Yeah, that's fine.
Alright, so this is your resting hand splint, and if you have questions like why you should use the splint, so to use the splint, you're going to want to, it helps to reduce the pain and protect your joints. It also helps with stiffness and any contractures that you may be having within your wrist and hands. It also keeps your hands and fingers in a safe, comfortable position. So some of the deficits that you may see with this or that you may be experiencing or diagnosis are just like arthritis, tendon injuries, burns or a stroke, and a spinal cord injury affecting your hand. So if you have questions of like where or when to wear your splint, you're gonna wear your splint when you're resting or like overnight. You don't want to have it on like all day long. You're gonna want to remove it 2 to 3 days just to check for like skin, just to see if there's like any swelling or if there's any redness on your skin. You're just also gonna want to follow your OT's instructions of like when you should wear it, like daily wear time, and it should be used like 4 to 6 weeks. Okay. So for splint care and safety with this, your splint should always be kept dry. If needed, just wipe it down with a damp cloth. You could also avoid activities such as like heavy lifting or anything that has to do with getting wet. So like cooking or anything like that. Also, don't force your fingers or wrist on into the splint. You're just going to want to ease it into the splint. So how to put on your splint, you're first going to like wash your hands before handling the splint. So what I'm going to have you do is pretend you've already washed your hands, and what you're going to do is you're going to put your hand in like this in a comfortable position, and then you're just going to make sure you go right here. Your thumb, you don't want it to go right here. You're going to want your thumb right here, and then you're going to push it down. You're always going to want to make sure there's like a one finger also space, and then you're just going to clip it like this. Okay? So now I'm going to have you do it, and then if you need any help, just let me know, okay?
Okay. So ease it in.
Yep. And then, yeah, and then you're going to want to do this. Here, and then, does that feel good to you?
Yeah.
Okay. Alright. Alright. And then also when doing this, you're just going to want to make sure that you slide your hands on and fingers should be in a comfortable position. Next, you're just going to fasten the straps to the splint like we did. To remove the splint, just loosens the strap carefully, and then check your skin for redness and swelling like we said when to wear your splint and just anything like that. But that's pretty much how you do a resting hand splint and how you put on and take off and just the precautions of it and everything. Are there any questions at all?
No.
No? Okay. All right. Then I will see you next time.
See you.